in the adductor brevis. Adductor brevis. And is attached here. You can see that the adductor brevis here. Again, here you can find it. The adductor brevis, number 3 here. Attach the line extending from the lesser trochanter to upper part of linea aspera. The adductor magnus, this is the largest muscle of this compartment. This is important point. Because of its double nerve supply, this is an important point, and we say that it's called a hybrid muscles. Hybrid muscles because innervated by two nerves. Hybrid muscles. Okay, the adductor magnus is the largest and hybrid muscles because innervated by two nerves. The infralateral, the origin of infralateral part of ischial tuberosity, ramus of ischium. Here, I draw it by another colors. The adductor magnus, originated from this area. Okay, this one is the adductor magnus. Originated these muscles from the, as I told you, is originated from the infralateral part of ischial tuberosity, ramus of ischium, lower part of inferior ramus of pubis, inserted to medial margin of gluteal tuberosity, linea aspera, medial supracondylar line, and adductor tubercle. Here is not show these muscles in picture because I show in the back muscles. And the gracilis muscles originated from the, again, originated from the medial margin of lower half of the body of pubis, inferior ramus of pubis and ramus of ischium, and inserted exactly near the insertion of the sartorius. Do you remember? Upper part of medial surface of tibia, behind the sartorius, and in front of the semitendinosus in Pesancernius. Do you remember? What this means, Pesancernius, I told you later, but here I draw with simple pictures. For example, this is the upper end of the tibial bone. This is the upper end of the tibia. Here, the upper end of tibia, three muscles inserted. Okay, three muscles inserted here. Semitendinosus and gracilis and the sartorius. Three of the muscles, one of them the anterior compartment, the sartorius. This is the sartorius. One of them from the medial compartment. This one is gracilis. The one of them from the posterior compartment, semitendinosus. Three muscles inserted, and the shape is like a specific structure. We say that pes ansernius, and the gracilis is the most medial muscles in adductor or medial compartment. You look at the gracilis, and this is a site of insertion of the gracilis. This is a gracilis. As I told you, inserted to body of pubis, inferior ramus of the, this is a gracilis, and this is a adductor magnus. Gracilis. This is a gracilis. And the pectinus is a flat quadrangular muscle. Is formed part of the floor of femoral triangle. It's attached or inserted from the pecten pubic, upper part of pectinal surface of the superior ramus of the pubis, and inserted to the line extending from the lesser trochanter to lina aspera. Here, this is a pectinus muscles. This is a origin from the, as I told you, pecten pubis and upper half of the pectinal line. And about the action, the adductor longus is a powerful adductor of the thigh at the hip joint. The adductor brevis again, adductor longus, adductor brevis help in adduction and flexion of the thigh. Adductor magnus, double nerve supply, adductor part by posterior division of obturator nerve, and the hamstring part, or that part inserted from the ischial tuberosity, innervated by tibial part of sciatic nerves. Adductor part cause adduction of the thigh, and the hamstring part helping extension of hip and flexion of knee. And the gracilis supply by anterior division of the obturator nerves. And the pectinus again is a hybrid, because anterior fiber by femoral nerve and posterior fiber by anterior division of the obturator nerve. Again, the action of this muscle is adductions. Okay, in these tables, you can see the some point about the insertion, innervation, and actions. Okay, the obturator nerves, as I told you, the obturator nerves is a, again, this one is adductor magnus. In this picture, you can see that the adductor magnus, as you see here, the lower part of adductor magnus, we have one opening. That name is adductor hiatus. You can see that the femoral vein and the artery pass through this hiatus and go to the back of the thigh into the popliteal fossa. You can see that these muscles in here, this is a insertion of the adductor magnus. You can see that the one part of the fiber inserted to adductor tubercles. Now about the adductor, about the, I want to talk about obturator nerves. Okay, the obturator nerve, as I told you, it's a branch of the lumbar plexus. It's formed by the ventral division of anterior primary rami of the L2, L3, and L4. Okay, the upper part of the nerve lie the pelvis. It enters the thigh by passing through the obturator canals. Within the obturator canal, the nerve divided into anterior and posterior divisions. Okay, I want to show you this nerves in the simple picture. If you imagine, for example, this is a one person in the lateral side. Okay, this is a one person in the lateral side of the body. Okay. Here, this is a pubis bone, pubic bone in here. I choose the another colors. I choose the another colors. For example, I show by this. Okay, this is the obturator nerves. The obturator nerves, as I told you, divided to anterior division and posterior division. This is the obturator nerve in here. Oh, this is the obturator nerves divided to anterior divisions, coming down. and here, excuse me, this is the nerves, and this one is a posterior divisions. Excuse me, it's coming down. This is a posterior and anterior, and here when this pass through the between the some muscles, for example, this is over the one muscles in here, one adductor muscles in here, the another adductor muscles in here. This is another muscles. This is another muscles, adductor muscles, and this one is another muscles in here. Okay, this one is a obturator externus, obturator externus. This one is a adductor brevis, adductor brevis. This one is a adductor longus, and this one is a pectinus. Okay, this is the obturator nerve. Okay, as I told you, it's divided to anterior and posterior rami. The anterior division or anterior rami passed down in front of the obturator externus, being separated from the posterior division by a few fiber of this muscle, is then descend behind the pectinus and adductor longus, and in front of adductor brevis, the anterior division supply the following muscles: supply the pectinus, supply the pectinus, adductor longus, gracilis, and adductor brevis, adductor longus, adductor brevis, if not supplied by posterior divisions, because sometimes adductor brevis supplied by posterior division in here. It maybe it's supplied by anterior or supplied by posterior division. It means that adductor brevis. The posterior division enter the thigh by piercing the upper border of the obturator externus. You can see here the piercing the obturator externus. It descends behind the adductor brevis, as you see in these pictures, and in front of the adductor magnus, if give branch to the obturator externus, adductor magnus, adductor brevis, if not supplied by the anterior division. In addition, this nerve supply the hip and knee joints, because the nerve has some sensory branches for the hip and knee joints. The obturator artery is branch of iliac artery and accompany the obturator nerve in the pelvis. This artery has an acetabular branch which pass through the acetabular notch to supply the fat of acetabular fossa and send a twig to the head of femur along the round ligament. The medial circumflex femoral artery, as you know, has ascending and transverse branches. The ascending branch of medial circumflex femoral artery anastomosis with the ascending branch of lateral circumflex femoral artery and superior gluteal artery to form trochanteric anastomosis. What does means? I want to show you this about this one. These pictures, as you remember, this is a medial circumflex. This is a profunda femoris. As you see the picture, this is a profunda femoris. This is a medial circumflex and lateral circumflex. As you see here, the lateral circumflex had the ascending, this is an ascending branch, and medial again, this has an ascending branch here. Now I talk about the one anastomosis. That name is the trochanteric anastomosis. Trochanteric anastomosis. As I told you, the ascending branch, for example, this is a medial circumflex. The medial circumflex has an ascending branch. Again, lateral circumflex has an ascending branch, descending and transverse. This is a medial circumflex. This is a lateral circumflex. Okay, the medial. As I told you, the medial circumflex has two branches. This is a medial, and this one is a lateral circumflex. The medial has a transverse and ascending, and lateral has a ascending, transverse, and descending. Okay, I repeat again. It means that these two ascending branch from the medial circumflex and lateral circumflex, in addition to one artery that come from the inferior gluteal, superior gluteal artery, Here we have a one anastomosis. Here, this is in this area we have a one anastomosis. It's formed by three branches, one ascending from the lateral circumflex, the one branch is ascending from the medial circumflex, and one branches from the superior gluteals. This give retinacular branch which lie along the reticular capsule of hip joint to supply the head of femurs. You can see that here there's some reticular artery. This anastomosis, his name is the trochanteric anastomosis. Okay. The transverse branch anastomosis with the transverse branch of lateral circumflex femoral artery and inferior gluteal and first perforating branch of profunda femoris form the cruciate anastomosis. Here, in the back of the femurs, again, we have another transverse from the medial circumflex, transverse from the lateral, the first perforating, and inferior gluteal, and first perforating artery, and making a one anastomosis here. That name is a cruciate anastomosis. This anastomosis is situated lower than the trochanteric anastomosis. Okay. Okay, that's all. This is a medial compartment of the thigh. See you in the next lecture. Then in the next lecture, I talk about the posterior compartment of the thigh.